My name is Peg, and I'm an RN, and I work for BJC Hospice. Hospice is comfort and peace for those patients and their families faced with a terminal diagnosis. Usually a doctor will recommend hospice when he sees that the technology is not there to extend their life more comfortably. And when a patient decides also, doctor, I've just had enough. I don't want to go back to the hospital, and I don't want to go through any more treatments. Hospice is wherever the patient is. Many times patients are in their own home and then they transfer to their daughter's home or son's home or even a nursing home. Wherever the patient resides, we are there. Most people think that hospice is just for cancer patients, but it's also for people that have end-stage cardiac diseases, ALS, COPD, end-stage dementia. We manage people that are bedbound and no longer eating. So it's not just cancer patients. The initial visit, you try to assess any signs and symptoms that are going to need managed in their disease process. Sometimes there's shortness of breath, or sometimes there's pain, edema, just decreased mobility and endurance, weakness, falls. Through our whole team, we try to manage all those signs and symptoms to make sure that they are more comfortable, more peaceful, with medications, therapies, and support. But the family is very open to receiving support. They realize that this is such a traumatic time, and they've allowed a comfort pack to come into their home, so we do have that on hand for emergency situations. Our social worker helps with issues regarding living arrangements and financial issues.
We talked about different options for caregiving so that she can get a break, and so I gave her a list of private duty agencies that are reasonable that can help her with that. They have a lot going on, so I will see them weekly.
And we have the chaplain who also provides such comfort and peace.
Are there other family members you think that might need support?
Yes, their children. We have music therapy, which is wonderful, and our massage therapy. We have the Lumina program, which allows patients to do a life review that's on record for their families, which is such an important history for them.
We did talk a little bit about the Lumina Life Review program, and she would like to gather some of his stories, and he was interested too in accounting some of his war stories and having that written so that his family could have that and his grandchildren could read that and have that as a legacy for him. So we will be in there once a week for caregiver relief, and then we'll add another volunteer for Lumina support.
The great thing about hospice is that they're never left alone. We're just a phone call away, 24 hours a day. You call, and on the other end is a nurse who is knowledgeable and can direct family members, and if they would need a visit, a nurse is sent out. My role is to try to take care of the total patient. At the end of the day, I just feel a sense of accomplishment when that patient has been able to express their innermost thoughts and feelings and fears, and if I have helped to allay them, it just feels wonderful.